Patient came in with lower back pain that started approximately 20 years ago, very chronic. It's beginning progressively worse since it started in his early 20s. He wasn't sure exactly what caused it, but did have some injuries occurring via work, roofing, some of these other things that may have contributed. He's been seeing a physical therapist for most of his life, which has kind of maintained some of the progression, but it's been getting progressively worse. Hasn't helped him too much, he describes, and he's not a candidate for surgery. Has a little bit of degenerative disc disease in the lower spine, the lower lumbar spine, but not much. He has some degenerative disc disease and osteophyte or calcification formation in the neck, which is not surgical either, but does have a lot of chronic neck pain as well into the mid-thoracic spine. The problem or the etiology or source of his pain is the left sacroiliac joint, which is very restricted, causing pain down into his buttock and left upper hamstring region, and also up the lumbar spine a little bit. Also related is some left posterior ribs in the lower thoracic region, the T7 to T9 area, which is usually very common to see with SI and lower lumbar injuries. As that ilium rotates, the ribs rotate posteriorly towards that in a compensating fashion. So those continually keep each other injured, unfortunately, or dysfunctional. Patient is going to need probably two to 3 months of care, adjustments, physical therapy, decompression therapy, a lot of muscle retraining, inflammatory deductions or reductions via muscle stim, laser therapy. But he should do very, very well. We already noticed after treatment of the patient that his range of motion improved incredibly well without pain in any, or with much less pain in those planes of motion, especially bending forward, flexion, and extension backwards, which were very painful before. Huge difference for him. He's never seen any difference like that before, and that's just with the first adjustment. We haven't even started the physical rehabilitation part yet. But he's going to do very well, and a great example of how you can change chronic pain patterns very quickly with the right kind of chiropractic neurological care and physical rehabilitation that's specific for his injury. Here you can see where the left sacroiliac joint is, okay? And you can see how if that were restricted, or this bone here, the ilium, were posteriorly rotated and taking this out of normal plane of motion, that could affect here in the buttock region and the hip, it could affect up into the lumbar spine, and even all the way up into the lower ribs here, as we were talking about earlier, where these are rotated posteriorly or towards us and rotated back into the left. Because the left ilium is rotated back into the left, it's kind of pulling these muscles together and causing a compensatory rotation. There are other few areas in the lower back that are problematic, but the majority of his pain is right in through here. In the cervical spine, what we can see is that the in the cervical spine, we can see that right in through here, his major area is C4, C5, and that's rotated with major muscle spasm in through here, probably with some of his osteophyte and calcification deposits, which will be seen on X-ray and MRI once we receive those. Patients should respond pretty well through there, depending on the extent of the degenerative disc disease. However, either way, he should respond very well.